Alright, so I want to do a bit of a recap. We're addressing some issues with his knee by looking at some of the tight patterns that fall along his calf, pull his femur head backwards, relate to his hamstring and up to his external rotators of the hip. So I started by doing some seated hamstring work. There's a separate video that shows how to do that work more thoroughly. But while I was here doing this seated hamstring work, I did some work to release the calf, myofascial work to release the calf. Some of what I asked him to do, so flex your ankle into the pillow and release. And I also had him do some work where he rotated the ankle. Good, perfect. And I also did some slow gliding work, transitioning the release that we had through here gently across the tendon of the knee and then up, using my thumb as a guide as I do the elbow. So this, of course, is a very rapid recap. I would go much slower, and I'm going to have more pressure if I was doing it in therapy mode. Following it up. I also did some broad ironing. I also, similar to some of the rib work I did, showed in some of the other videos, while I'm ironing, I will kind of push along the IT band and then release. That gives some give underneath my elbow and forearm, and then lengthening. You can follow it all the way up. And if you're working with someone who has underpants on, up through here you can do some work through the sheet. Even just some simple leaning through, around the hips and in the piriformis. Something that's also nice is while you lean, if you want to help the fascia shorten and lengthen, you can also come up and kind of rock along the lateral edge of the scapula. That feels good. It both lengthens underneath the lower hand and then shortens when I release it. You can also do some work by anchoring the piriformis and playing like a windshield wiper with the leg. You can also play with some engage, disengage, so bring your ankle towards the center, yep, and release. And also ankle towards my hand, and release. In this work, you can also do some of this with lotion and gliding. Sometimes I will ask the client as I come up to gently bend your knee to 90 degrees, slowly. And then once it's up to 90 degrees, have him gently move his leg from side to side, like a windshield wiper, and then come back. Sometimes I'll support it and move it. And I may also change my working elbow. How you doing?
Good.
Okay. Maybe getting that femur head to move underneath my elbow. There you go. And you can also do some more specific work that I won't show necessarily on the video right now, but rocking is also a really nice way to integrate it. So to recap the recap, he had an external rotation that was impacting his medial knee. The femur head was pulled back a bit by his hamstring, and an external rotation and over tightness of the lateral hip flexors. Okay.